Good evening, everyone. Today we're going to be doing the second round of oral presentations. So each speaker will have 15 minutes, 10 minutes to present, followed by a 5-minute Q&A. I request everyone to please keep their phones on silent, and we'll begin with Akshat Joshi from ISC Bangalore.
Thank you very much for your nice introduction. So good afternoon, everyone. My name is Akshat Joshi, and I'm working as a postdoc scholar in the Department of Material Engineering and Indian Institute of Science. And being a material scientist, I'm working on how to develop biomedical devices that can enhance the regenerative capacity of a damaged tissue. And in particular, today I'll be discussing about 4D printing of hydrogels in the treatment of peripheral nerve injury. So the reason I choose peripheral nerve injury as one of the application is due to the high expenditure and large number of people suffer from this disease every year in the United States. Coming to the symptoms of this disease, you can see that once there is a peripheral nerve injury, your motor functions are gone, your muscles start to degrade, and you have hypersensitivity to pain. And in worst case, the patients can also develop paralysis. So the current treatment includes using of nerve stubs or nerve grafts. So you can see that both of these techniques have some disadvantages. Like in case of nerve stubs, there is shortening of the nerve and it's not possible to bridge bigger gaps. And for nerve grafts, there is a donor side morbidity in case of autografts, and there is a graft rejection in case of allografts. So axon guiding devices are the new era of peripheral nerve injury treatment, where you have a nerve guiding conduit, which can be a synthetic or a bioactive scaffold, which can be sutured at the site of the damage, and it can help in neurite extension and finally the nerve regeneration. So this is smart platform designs through synthetic or natural materials. So coming to the commercial conduit, Stryker is a leading producer of some of the nerve conduits, Neuroflex, Neuromend, and Neuromatrix. These are 3 types of nerve conduits produced by Stryker. And depending on the type of injury, you can choose among 3 of them. The disadvantage of these conduits is that they need to be sutured at the site of injury, and that have many complications. They make the surgery very complicated and come away with inflammatory responses from the sutures. Then these are basically collagen-based sheets, and there are no directional cues, and also these are non-conductive materials. And as we know, for nerve regeneration, conductivity is a very important aspect. So in the current topic, I'll be trying to explore the 4D printing material to overcome the challenge of the current existing technology. So coming to 4D printing, so basically it's a 3D printing technique where you start with printing a static object which is design encoded during the printing process, and under certain stimulus these structures can deform over time. So the 4th dimension we talk here is time. So a static object can actually deform over time under certain stimulus, and in our case for hydrogels it's basically swelling that causes them to deform. So if you want, if we see the concept of 4D printing, so it can be explained from the classical Timoshenko beam theory, which explains that if you place 2 materials one on top of other with differential expansion ratios, they can actually deform into a particular fashion due to the residual stresses that are generated due to strain mismatch. So we want to apply the similar concept for hydrogels. So this is a computational model we are using. So we place 2 hydrogels one on the top of other in certain fashion, and they can actually deform due to the residual stresses caused due to differential swelling. So this is the computation model we are using in this research. And as per this model, we try to develop a gel system. So we are basically using alginate and methyl cellulose based hydrogel in this study. The reason to choose this gel system is both are FDA approved materials and they have good printability. The printed structures can have high shape fidelity, and there is a facile cross-linking mechanism using calcium chloride solution, and they're highly biocompatible, and we can easily tailor the composition of these 2 materials to have significant swelling differences. So in this study, we are using 2 concentration of alginate and methyl cellulose. One can have a higher swelling ratio and one can have a lower swelling ratio. And then we place them one top of the other, and we can actually generate dynamic hydrogels. So before we go to the actual deformation of the gels, we firstly characterize them for their printability. So we perform rheological analysis. We confirm that the gels were shear thinning and they were thixotropic and they were viscoelastic, which is the properties of most of the tissues in human body. And also we can obtain differential swelling ratios by choosing different concentration of the 2 pre-polymer solutions. Next, we begin to validate a model. The purpose was to check how we can actually make the structures to deform into a particular fashion by placing material in different fashions. So through computation model, we can actually predict that a particular geometry can actually deform into different fashions by simply placing the materials in different fashions. And then we also validate them experimentally. So you can see that same geometry can actually bend or twist depending on the type, how we place the material one on the top of another. We also validated a model for other shapes, like one of the petal shape. We can see like the structures can actually deform or they can twist depending on the computational model from where we get the designs. So these are simple structures to show as a proof of concept, which I'm showing here. There's nothing to do with the application, which I'll be showing in the upcoming slides. Then we also check for another multiple shapes, like for this shape, actually, we can predict different deformations simply by placing the material in different fashions. So they can actually bend or they can twist, and in this case, a butterfly wing movement can be controlled simply by design concept. So we can see in real time that the wings of the butterfly can actually close or they can twist depending on how we place the material. So this was how we optimized our system. Next, we want to exploit them in the area of regenerative medicine. So we want to make them biocompatible. We want cells to adhere on them. So the good thing about our study is that we can easily coat them with ECM components. It can be nanofibers. It can be a conductive fibers, depending on the application. And we confirm that these coatings don't impact the don't impact the deformation. So you can see these are the coated gels and these are the uncoated gels, and they can actually deform in similar fashion without any major impact on the shape deformations. Next, we check that how these fiber coatings can actually improve the cell material interaction of the scaffolds. So these are the material without fibers, and these are with fibers. And we can see that when fibers they were coated with ECM, cells can nicely spread on the surface. They were highly viable. They can proliferate over time. And also in the actin staining, we can clearly see that cells can nicely spread on the surface of the scaffolds, which were actually clustering when no ECM coating was there. Then we also place them in subcutaneous rat model to see whether they have any inflammatory response or immunogenic rejection post-implantation. And we confirm that the gels have no inflammatory response. And if we analyze the histology of two vital organs, liver and kidney, and they were healthy, and also the body weights of the animals were constant in case of sham and both the implantation. So we confirm that these gels were biocompatible both in vitro and in vivo. Then next we moved to the application of this gel as sutureless nerve conduits. So we begin with designing simple design. We simulated using our computational model, and we can actually obtain conduits out of flat sheets. So next what we did that we placed these flat sheets interoperatively during the surgery, and they can spontaneously curl and clamp the two ends of the resected nerve. Now we want to evaluate the effectiveness of our system for peripheral nerve recovery. So before we move to that point, we did a minor characterization of our gel system. So this is the 4D printed conduit, and this is the SEM image showing that the conduits were highly porous, and this is a biomechanical characterization that we perform to check the biomechanical properties of the conduits. Next, we move to the surgery part. So we developed a sciatic nerve model, rat model, where we resected the nerve. We create a 2 millimeter defect, and these flat sheets were placed at the defect site, and they can spontaneously curl and clamp the two ends of the damaged nerve. So we don't need any sutures here, so they go a long way in reducing the complexity of the surgeries and also the complications that come along with sutures. Then we evaluated the effectiveness of these hydrogels in repairing the damaged nerve. So this is the studies we performed. So we did the implantation on day 0 was the day of implantation, and then we performed various behavior tests to confirm the recovery of motor and sensory activities. And finally, after 6 weeks, the animal were euthanized, and we did histological analysis to check the effectiveness of our material in regenerating the damaged nerve. So this is the image showing the 4 groups we used. The sham is the group where there was no damage made, and the negative control has no conduits placed there, and there were 2 hydrogel groups. One were non-coated and other was coated with ECM coating. So this is the image after 6 weeks of implantation, and we can see that the conduits were nicely placed at the position without any sutures, and we can also see amount of angiogenesis happening in the coated conduits. Next, we went to the evaluation of motor activity. So this is the, So this is the motor activity. So when the nerve is damaged, the limb movement of the rats is lost, and we can see that the left limb, the rats were not able to open their paws, but with the treatment, the paws were nicely opened after 45 days of implantation, which was absent in case of negative control groups. Then we also checked the cytic function index, which showed improvement after 45 days of implantation. And we also checked since nerve damage also caused disintegration of muscles, we checked the muscles weight was recovered after implantation of these scaffolds. And this is the histological images of the GA muscles. This is sham where there was no damage, and this disintegrated muscle morphology can be seen in negative controls, but the coated and non-coated groups showed healthy physiology of GA muscles. We also did some hot plate latency and paw withdrawal threshold tests to check the recovery of motor activity. And in each case, we can see that both the treated groups showed great improvement in both the motor response of the nerves. Then we also did some histological examination of the damaged area, and we can see that there was recovery. We can see a nice ECM with Schwann cells and neurites extension. And finally, we stained them for neuroinflammatory markers, NF160 and S100 beta, and we can see all the markers were highly expressed in the treated groups. So coming to the summary of this research, so we developed a 4D printed system of alginate and methylcellulose. The shapes can be programmed in accordance with the computational design, and we can coat these gels with ECM without affecting the shape deformations. And gel system don't show any signs of inflammation upon subcutaneous implantation. Gel system can be employed as sutureless nerve girding conduits. And based on the dynamic nature of our 4D printed hydrogel, they can be further employed in other areas of regenerative medicine as well. So I would like to thank all the members of my group. So we basically belong to Biomaterial Group and Indian Institute of Science. Thank you. You can just...
Audience members, if you have any questions, please go ahead. Sir.
Yeah.
Akshat, we have 4 minutes left to answer any questions.
So yeah, a fantastic work, and very, and being an engineer, I really like that. But I could not follow that. Why do I need a self-wrapping one? Why can't I put a tube, made of the similar material?
The reason is that if you talk to a doctor, a medical doctor, these microsutures are very complicated. So once you place them, you need to suture them to fix them at the defective site. And that can also cause additional inflammatory responses that can delay the process of healing. So in this case...
Without suture, like if I have a kind of a tube of, say, your material, only biomaterial, and I put the nerve ends from both the side and use some glue, the tissue adhesive glue. And
that can be one of the possible way, but the conventional way is to put sutures only. So we just want to avoid sutures. That's why we developed a system that can spontaneously roll. And this takes just 20 to 30 seconds for the system to clamp the nerves tightly. And with movements also, we can see that they were still intact there, which might not be guaranteed in case of using a glue or other medical adhesives. So, yeah.
Beautiful.
Any more questions?
Did you do a benchmark against alternative methods? So,
Pardon.
did you compare the effectiveness?
Yeah, we have to do that. So we will be comparing in future studies, we'll comparing with the commercial conduits, with autografts, with allografts, and we'll see how effective our system is over other current methods. Because we want to we are planning to commercialize them. There's no Indian company that is actually dealing with conduits. It's only a Stryker that is dealing. So we will be comparing in the future studies. We will further improve our system by making it conductive, by making it so that the neurites can nicely extend within the nerve conduits. So these are long plan.
So how many these peripheral neuropathy, how often does it occur? So did you check?
So yeah, sir, actually it depends on the size of the defect. So if the defect is small, you can easily suture the two ends of the nerve and it can regenerate. But if a defect is greater than 10 millimeter, you need to put a conduit to provide directionality for the neurite extension. So we are focusing on large defects, which can also lead to cases as high as paralysis. And these are biodegradable material. You don't have to perform a second surgery. They can regenerate the scaffold and can degrade over time.
Is it also applicable to the spine?
Thought of spine, but we are now going for vascular grafts because that is also another problem, cardiovascular diseases. So we are also now moving for vascular grafts to employ them as vascular.
Okay. So nice talk, Dr. Joshi. Very nice. Now my question is, in your defect model, did you make a like a incision of the nerve also, or it was just cut only?
Yeah, we just resected the 2 mm nerve and created a 2 mm defect.
2 millimeter.
Yeah, so we did it for 2 mm now. Definitely we want to go for higher gaps like 10 mm, mm. But for we will further improve the system by making it conductive and other properties. We can add certain neurotransmitters, growth factors, and then we can go for larger gaps as well.
Okay, okay.
So,
No,
yeah.
2 millimeter is good enough.
Yeah.
I could not get that. Thank you.
Okay, thank you.
May I? Hello. Is it audible? Yeah. To that question, sir, you raised, like, can we use this for the spine? Like there are available, like injectable gels are there, hydrogels, which have to be injected at the site of your spine where it is the damage is there. and
Can
they
we
actually
please limit it to questions for now? Because we're on a time.
Actually, it's a
Yeah.
nice work. Can we use this for drug delivery system? Like
We
for
haven't- we
releasing the
haven't-
drug across the time?
Yeah, I mean, we optimized a different set of polymers for that. We use shape memory polymers for drug delivery. Hydrogels, we are just using for soft tissue engineering.
Okay, we can incorporate the drug also.
Yeah, definitely,
Using
definitely.
the four same.
Yeah.
Nice talk.
Okay, thank you, Akshat.